Sexual orientation and emotional safety. Now there's a subject, and that is something that comes into the therapy room on many occasions. I can single-handedly dispel any idea that sexuality is acquired. Trust me, you're born with it. My brother is gay, and we knew when he was 2. Over the generations, there have been challenges for anyone who was questioning their own sexual orientations. Being in a heterosexual relationship has largely been considered as accepted norm cross-culturally. Yet there are plenty of tales of personal trials and grief of those in the past who were punished simply because of their sexuality. However, in the last 2 or 3 decades, society has only started to change and gradually become more accepting. That's not to say, of course, that those who identify as gay, lesbian, or any other sexuality are not continued victims of abuse, verbal and physical, and in some cases, sexual. They, or rather you, can find yourself ostracized by your community, starting at a very young age. Many clients approach therapy as victims of society's attitude towards their sexual orientations. Oftentimes, their identity is in tatters. They may be lonely, isolated, and in need of rebuilding and of support. Who you are as a human, meaning your identity and your sense of self, is often linked to your sexuality. Indeed, your sexuality plays a critical role in establishing both of the above. When we talk for sexuality, we refer to a person's sexual orientation or preference. It directs you to who you are attracted to at an emotional level. Who you are attracted to mentally and physically. This applies to all gender orientations. You may be happy to describe yourself as gay, lesbian, bisexual, straight, pansexual, something else, or you may not be quite sure of your sexuality just yet. Sexuality can also be used to reference to a person's capacity for sexual feelings. And sexual drive is more than the need to reproduce another human. Sexuality is also an important part of what we call the human emotional experience, and also our deep connections with other people. Research is not yet clear whether our sexuality results from genetic or hormonal factors, our childhood and parenting, or the society and culture we grew up in. However, don't ever doubt that exploring your sexuality is normal, healthy, and deeply personal. Being supported and safe to explore and express your sexuality can be good for your mental health. It can reduce distress, anxiety, depression. And certainly in the UK in the last 10 years also, many lesbian, gay, bisexual, transgender and intersex people have been free to live outwardly happy and rewarding lives with growing and more mainstream acceptance, which is absolutely wonderful. But not everyone experiences is the same. Some people may experience poorer mental well-being and health because of social culture stigma, discrimination, violence, and exclusion from your community. Your sexuality is central to your self-identity, and not being able to express this is corrosive to your sense of self-worth and self-esteem, including your overall mental health. For some people, coming out leads to acceptance and support, especially from those nearest and dearest. This is obviously the outcome that everyone hopes for and strives for. But ask yourself, why is it that so many people find it so very hard to tell those closest to them in the first instance about their sexuality? It may not always be the case that the news will be well received. If you are currently making the decision to come out, try to prepare yourself to cope with people's responses. Many people will support you, but there may be others who don't. Ask yourself, what will you do if those you depend upon the most emotionally do not take the news well? It can take time for others, especially family members, to understand, adjust and accept that all this means and learn how to support you. For them, the life that they have envisaged for you, and perhaps more selfishly for them, may suddenly have disappeared. Those around you who do not or cannot accept or understand what you are experiencing may express this in a myriad of ways. If you are concerned about the reaction you will receive when coming out, why not have a plan and choose carefully to whom, how and when you break this news? The journey can be tough. Culture and tradition can play a significant role in the reluctance to be honest about one's sexuality. 51% face discrimination within the LGBT community still here in the UK. Equally, more than a third of trans people, 36%, 1 in 8 LGBT disabled people whose activities are limited a lot, 13%, and 1 in 5 LGBT people of non-Christian faith, 21% say they're experienced discrimination from within their community because of different parts of their identities. Only half of lesbian, gay and bi people, 46%, and trans people, 47%, feel able to be open about their sexual orientation and or their gender identity to their whole family. A third of bi people, 32%, say they cannot be open about their sexual orientation with anyone in their family, and consider the dearth of those from the LGBT community in public office or in sport, particularly professional footballers or other high-profile professionals. Surely this is another sign that still too many individuals are struggling to come out. Also, it can be the case that those from first and second generation immigration backgrounds suffer most in being able to freely come out and live their lives as who they really are. If you have difficulties with family members who do not understand and also don't want to understand what you're going through, this does not mean that they do not love or value you as a person. They just don't want to actually learn about that part of you. Cultural traditions, norms, outdated values, lack of education and awareness on these very personal emotional issues have only recently started to be addressed in many communities. It will take time, patience, courage and effort from those closest to you to change old, entrenched ways of thinking and behaving. You may find that you are the one, rightly or wrongly, who has to keep the doors open for honest conversation and questions. Rejection and isolation is painful when our loved ones don't get it. This is the real you. This will happen sometimes, and positive outcomes, but not always. In this instant, then, self-care is critical to help you manage these challenges, and to understand that others will feel whatever they feel. These difficult reactions and feelings are no one's fault. It's very important that if and when you do decide to tell people about your sexuality, that you are in a safe environment. If possible, have a nominated support person with you and choose a comfortable, neutral territory to do this. If you feel unsafe around loved ones at any time and they are not being respectful or are being discriminatory, it is vital to ensure you have a safe support network to fall back on. When do you come out? Common factors that can affect your emotional health and well-being include feeling different from other people around you. Homophobia or sexuality-based discrimination can make it difficult to enjoy life to its full. It may be that you notice physical symptoms that this is affecting your sleep, appetite, concentration, or relationships. It might be time to get some help. So don't forget about self-care in this instance. It can make a positive difference to your well-being. Small changes like trying to improve your diet or taking regular exercise can make a massive difference. Try to avoid substance abuse and make time for those people who you trust. It is sadly quite common that those in the LGBT community find it really hard to ask for help. Sometimes this is because they have faced discrimination in the past by health professionals or have real concerns about issues of privacy. It is, though, so important to find someone, hopefully a GP or someone professional who you can confide in and direct you towards appropriate support. In the end, you have one life, and it's your life to live honestly and to its full. Surround yourself with people who love and accept you for who you are.